Hi, my name's Martha Bray. I'm a holistic family nurse practitioner, and I'm here to give you a little bit of information about Prolozone Therapy. Now, you're probably sitting here because you've got some pain, some discomfort somewhere in your body. Prolozone can be used throughout the body for all kinds of different things. Now, if you think about what ozone is O3, so it's a gas. O2, which is oxygen. Oxygen is a gas, you can't see it. Ozone is O3 with an extra oxygen molecule. It's also a gas that you can't see. Now, in Prolozone therapy, what we do is we inject a substance first. We inject a combination of B12, B6, procaine, homeopathic, a little anti-inflammatory. Sometimes we use DMSO. We do a formula actually that's customized for what your specific needs are. So we inject that first into the area being treated, and then we inject ozone over the top of it. We're doing two things. One thing is we're trying to get nutrients into the joint or into the soft tissue where there's pain and discomfort to give it healing nutrients for healing and repair. The ozone helps increase oxygenation into the tissues, and also ozone is antiviral, antibacterial, and antifungal. So typically what you see, for example, in joints, whether it's a knee or a back, different places, frequently you have infection process going on in that joint, which is one of the reasons why it doesn't heal. And it starts to degenerate over time. When we do Prolozone therapy, we can do it anywhere actually in the body. The most common areas are the knees, the backs, the hips, the shoulders, hands, elbows, but any soft tissue can also be used with Prolozone. It's a very effective treatment. People sometimes have relief after the very first injection. Sometimes people have to have 3 or 4 injections, sometimes more. It really depends on, number one, how long has the problem been going on. For example, if you have a knee that's bone on bone, it might take more than just 2 or 3 injections to get that cartilage to start to regrow. And that is possible. Yes, that is possible. So you want to heal and repair, give those areas the nutrients that they need to heal and repair. Now, people also are wondering, well, how often do I have the injections? Do I have 1? Do I have 10? Do I have 50? That is very specific to you and very individual. Sometimes some people need 1 injection, that's it. Most commonly, people will need, 3 or 4, 5 or 6. It depends on what you have going on and what your specific needs are. The other question that people have is, how frequently do I do it? Do I do it every day? Do I do it every few weeks? The recommendation generally is initially do an injection, and then about 3 weeks later do another one. Then the next one, maybe 3, maybe 4 weeks later. So generally what happens is over time you can spread them out further and further. In between, the body is doing its own healing and repair work. Let me explain briefly the difference between prolotherapy and prolozone therapy. With prolotherapy, you're using a completely different substance than you are in prolozone when you're doing the initial injection. And the other main difference is the use of the ozone after the initial substance is injected.